UnitedHealth Group is a healthcare giant that offers a variety of products and services to millions of customers. But how did it become such a dominant force in the industry? Let's take a look at its history and evolution. UnitedHealth Group started as a small health insurance company in 1977 when it was founded by Richard T. Burke as United Healthcare Corporation. It originally processed claims for doctors at the Hennepin County Medical Society in Minnesota. It became a publicly traded company in 1984 and changed its name to UnitedHealth Group, and the company expanded into various segments of the healthcare industry through acquisitions and innovations. Some of its milestones include: in 1988, it started its first pharmacy benefit management service, which managed drug benefits for customers through retail and mail pharmacies. It sold this subsidiary to SmithKline Beecham in 1994 for $2.3 billion. In 1995, it acquired the MetroHealth companies, which provided health plans for employers and government agencies. This gave UnitedHealth Group access to a large customer base and increased its geographic reach. In 1997, it achieved its first significant success when it was selected by the AARP, American Association of Retired Persons, to provide coverage for its members. This was a lucrative contract that boosted UnitedHealth Group's reputation and revenue. Also in 1997, it expanded its Evercare program, which offered coordinated care for seniors and people with disabilities. Evercare was one of the first programs to use nurse practitioners to provide home-based care and preventive services. In 2002, it merged its Medicaid business with AmeriChoice, which specialized in serving low-income and vulnerable populations. This made UnitedHealth Group one of the largest providers of government-sponsored health plans in the country. In 2003, it acquired Golden Rule Financial, which offered health savings accounts, HSAs. HSAs are tax-advantaged accounts that allow people to save money for medical expenses. UnitedHealth Group became a leader in this emerging market. In 2004, it acquired Oxford Health Plans, which operated in the Northeast region. This strengthened UnitedHealth Group's presence in one of the most competitive and affluent markets in the U.S. In 2006, it launched Optum, which became its health services platform. Optum provides data analytics, technology solutions, pharmacy services, care delivery, and population health management for customers and clients across the healthcare system. In 2011, it acquired Ingenix, which was a health information and technology company. Ingenix was rebranded as Optum Insight and became part of Optum. It provides data-driven insights and tools to improve healthcare quality and efficiency. In 2012, it acquired XL Health, which operated Medicare Advantage plans for chronically ill seniors. This enhanced UnitedHealth Group's capabilities in managing complex and high-cost cases. In 2015, it acquired Catamaran, which was the fourth-largest pharmacy benefit manager in the U.S. Catamaran was integrated into OptumRx, which became one of the largest players in the pharmacy services market. In 2017, it acquired Surgical Care Affiliates, which operated ambulatory surgery centers and surgical hospitals. This expanded UnitedHealth Group's portfolio of care delivery services and facilities. In 2018, it acquired DaVita Medical Group, which operated physician groups and clinics in several states. This added more than 15,000 doctors and clinicians to UnitedHealth Group's network of providers. In 2019, it acquired Equian, which provided payment integrity solutions for healthcare payers and providers. This improved UnitedHealth Group's ability to prevent and recover improper payments in the healthcare system. These are just some of the examples of how UnitedHealth Group grew from a small health insurance company to a healthcare giant that covers every aspect of the industry. Today, UnitedHealth Group serves more than 140 million people in all 50 states and more than 130 countries. It has more than 380,000 employees and generates more than $280 billion in annual revenue. It is ranked as the 7th largest company in the world by revenue and the largest healthcare company by revenue. UnitedHealth Group's mission is to help people live healthier lives and to help make the health system work better for everyone. It does this by offering a broad range of products and services that address the diverse needs and preferences of its customers. It also invests in innovation and research that aim to improve healthcare quality and outcomes. UnitedHealth Group is a healthcare giant that has risen to the top of its industry by expanding into various segments and leveraging its scale and expertise. It is a bottom-line dominator that shows no signs of slowing down. UnitedHealth Group is not only a healthcare giant, but also a controversial one. The company has faced criticism and lawsuits for its business practices, such as denying claims, influencing policy, and lobbying. One of the most recent challenges to UnitedHealth's dominance came from the Justice Department, which sued to block its $13 billion acquisition of a health technology company called Change Healthcare. In February, the agency argued that the deal would give UnitedHealth access to sensitive data that it could use against its competitors in the insurance market. The lawsuit was joined by New York and Minnesota, two states where UnitedHealth has a large presence. Another source of controversy for UnitedHealth is its use of an algorithm developed by its subsidiary Optum, which is supposed to identify patients who need extra care based on their future health costs. However, a study published in 2019 found that the algorithm was racially biased, as it favored relatively healthy white patients over sicker black patients. The reason was that black patients tend to have lower health spending than white patients with similar conditions, due to factors such as lack of access, discrimination, and distrust of the health system. The New York Department of Financial Services launched an investigation into the algorithm and demanded that UnitedHealth either prove that it was not discriminatory or stop using it altogether. UnitedHealth has also been accused of limiting payments to doctors and hospitals, forcing patients to pay more out of their own pockets. In 2009, the company agreed to pay $400 million to settle allegations brought by the New York Attorney General and the American Medical Association that it used a flawed database to calculate reimbursements for out-of-network providers. The settlement also required UnitedHealth to create a new independent database to determine fair rates for medical services. In addition to these legal disputes, UnitedHealth has also faced criticism for its political influence and lobbying activities. The company has spent millions of dollars on campaign contributions and lobbying efforts to shape health care policy and legislation in its favor. For example, in 2017, UnitedHealth CEO David Wickman reportedly called Republican senators to urge them to repeal the Affordable Care Act, which had expanded coverage and benefits for millions of Americans. UnitedHealth has also lobbied against proposals such as Medicare for All and a public option, which would create more competition and regulation for private insurers. These are some of the ways that UnitedHealth Group has faced criticism and controversy for its business practices, which have often prioritized its bottom line over the health and well-being of its customers and providers. While the company has defended its actions as necessary and beneficial for the healthcare system, many critics have argued that UnitedHealth's power and influence have harmed consumers, providers, and public health.